hope you can you hear me, everybody?
Yes, we can.
Excellent. Thank you so much for inviting me to take part. I've been invited mainly for my talk to focus on the subject of long COVID, which is obviously very, very relevant to both accessible healthcare and accessible vaccines. I'm aiming to talk for a maximum of 15 minutes. Please let me know if that's not the timing that you are looking at now. And if I can share my slides while I'm talking, that would be great. So I'm going to try and do that now.
2:15.
Can you see my slides?
Yes, we do.
Brilliant. Thank you so much. So I'm talking about long COVID, why the world needs to look beyond the acute health effects of SARS-CoV-2. So when this pandemic started in early 2020, we had a very black and white narrative for this pandemic, which is basically that the majority of the population with this virus, and from what was being observed early on in China, would be fine, really, unless they're at risk with, having risk factors such as old age or other underlying medical conditions. It would be something like a cold or short flu-like illness, and they would recover quickly. And then you've got a minority who are at high risk that we need to do all we can to protect them against this virus. And actually, to my dismay, this is still predominantly the narrative that we have now, even though we're more than a year and a half in the pandemic. And what's been missed from this narrative right from the start is this gray area in the middle, which is people who become ill with prolonged illness following infection with this virus and do not recover quickly or haven't recovered yet. So one thing that is confused in the narrative and continually confused is the confusion between survival and recovery, so full recovery from the virus. And I want to just mention a kind of a very quick story, because I was in this gray area in March 2020, when the pandemic hit the UK hard. I had the symptoms of COVID-19. And as the narrative goes, I thought since I'm not in the high risk group, I thought this is going to be a very short-term illness. And I was working hard on the public health response to COVID-19. But actually, as the weeks and the month went, I didn't completely recover. This illness was hitting me back. My symptoms were hitting me back, fluctuating over time, disabling my activity. And they were very concerning. And what kept me going at the time, because there was no official message around this prolonged illness that could hit some people, what kept me going were other people in a similar position as me, posting on social media, mainly, saying, we're experiencing this. Sorry. Okay. So saying we're experiencing this, we're not recovering, or don't know what's happening. And there were a lot of people who, again, weren't classed as so-called vulnerable at the time in relation to the risk of the virus. So there wasn't really anybody talking about this, although we know from other viruses that post-viral illness is a problem. So, for some people infected with other viruses would have this prolonged illness after infection. But actually, in the context of the pandemic, my main area was public health and trying to quantify the effect and factor it into policy, pandemic policy. This wasn't being talked about. So I shared my experiences. I shared my personal experience as a really story to get into the public health angle of we're not really counting this. We're not measuring it in any way. What is the effect of this on the community, on people, on the productivity? There was these conversations about the economy versus public health. And actually, this is a big thing for the economy, to have people who are working age people, disabled, and not going back to their normal health and, in terms of employment or in terms of their caring responsibilities. And then, we started saying we need to count long COVID, through social media, through writing, and, going on media saying that we need to quantify this problem, because all that's being quantified is deaths from the virus Hospital admissions, the narrative about not overloading the healthcare, otherwise healthcare will collapse, and the number of infection. But who's quantifying this kind of what looks like a chronic illness generated by huge numbers of people getting infected? So what is it? What are we talking about when we talk about long COVID? Well, long COVID, as I said, started as the name came from people on social media talking about long COVID. So, it was originated from Elisa Perego. She's a researcher in Italy who actually called it long COVID, and that name was taken up by people with the condition, and support groups formed. But basically, it means you're not fully recovering, you're not going back to your normal level of health or functional activity as you were before contracting SARS-CoV-2. So this includes having symptoms, this includes your level of functional activity, so your day-to-day level of what you do, and includes observed pathology or organ damage detected by healthcare. And it happens in even so-called mild COVID-19 cases, because again, that was the black and white picture, severe COVID versus mild COVID, and people are not hospitalized generally, were considered mild, but it is common. Finally, we do have a clinical definition of long COVID or post-COVID-19 condition, as the WHO has named it. And that came out a couple of days ago, but basically saying after 3 months from the onset of COVID-19, if people haven't recovered and it's not explained by an alternative diagnosis, and it impacts on everyday functioning, then that's long COVID. Basically, that's not restricted to people who have confirmed COVID-19 by lab diagnosis. I mean, the majority of people with long COVID from the first wave of the pandemic in many countries, UK and some other countries, couldn't even have access to testing to confirm their infection. And that resulted in a lot of difficulties later. So what are these symptoms? They're really wide ranging, but they're kind of commonly, there's a sense of what we call fatigue or, exhaustion, people feeling very lack of energy following, whether it's triggered by physical activity or stress or mental activity, or whether it's unknown in terms of its trigger, but also breathlessness, cognitive dysfunction in terms of poor memory, poor concentration, chest pain and chest heaviness, muscle aches, dizziness, joint pains. So you see the range of symptoms that people report commonly in long COVID. And what's happening now, as I said, it's an umbrella term. It could be several things happening under this umbrella term. It could be because there's organ damage from the virus, and we know the virus, it produces devastating organ damage in people with severe COVID-19. It could be continuous inflammation. It could be an autoimmune process, like some other autoimmune diseases where it's triggering, and that could really is consistent with the relapsing and the fluctuating nature of long COVID in most people. Could be high, the coagulation problems, and again, we know the virus causes that, and even the hypothesis that might be low level of persistent virus persisting in people, that still cannot be completely excluded. In terms of how common it is, well, around I think there've been more studies counting long COVID, and I think overall that's probably some consistent estimate coming. So out of everybody infected, it's probably 1 in 10 who would have these symptoms and not going back to health about 3 months after the infection. And if you count out of people who are first acutely symptomatic, because we know that SARS-CoV-2 could be completely asymptomatic in people, out of the symptomatic people, including so-called mild cases, it's probably 1 in 5. So quite staggering numbers. It is more common if you have an initial severe disease, and also seems to be more common in working age adults. And that has really strong implications in terms of the productivity, economy, and how we keep our societies going. In the UK, the Office for National Statistics have been producing regular estimates, and their latest estimate, just to give you a feel of how common this is 1.1 million people in the UK living with long COVID. That's 1.7% of the total population, really staggering numbers. And out of these, over 200,000 say that having long COVID or having these symptoms limit their day-to-day activity a lot. And if you can see the age groups here, it's all, it's in all age group, including young children. It happens including young children, but we can see the highest is in 35 to 49 years old, which is, as I said, the working kind of age groups, and also parents and the carers in the community. We can also see here that in terms of professional groups, people who are exposed more to the virus, healthcare, social care, teaching, education, tend to have higher prevalence of long COVID. And I'm just giving this table from a survey we've done about the suffering loss of income, loss of job, taking time off sick, and you can see some patterns emerging, whether you've got a confirmation, a lab confirmation of diagnosis or not. And as I said, in the first wave, many people didn't have that. And that seems to be detrimental. But in both cases, it's quite a big proportion who've reported, for example, loss of income. So needless to say, and this is about accessible vaccine, the best thing to do for long COVID is prevent more long COVID from happening, because the pandemic is still raging in many parts of the world. It's not past tense, it's still happening, and it's everybody's problem. And really about trying to marry this message of, COVID does not just affect a tiny proportional population. There are these people who are classed generally in the media as low risk, who could be suffering from prolonged symptoms, and it can affect their life for a long time. And obviously many of people with long COVID now, over 18 months in, they're still suffering the effects. So it's not just a couple of months for a big proportion of people. So preventing the acute infection is key, and that's obviously the role of vaccines, has a very big role to prevent them. And that's not only in people who are classed as high risk of severe disease, but we have secondary infection, which is what can we do to prevent the progression to long COVID? And there's a big role in research in that. And also the tertiary prevention is preventing complication and disability, and improving quality of life. We can get back to this if we need to in the discussion, but this is from an article I wrote in Science to try and summarize what is it that we need from a public health point of view and a healthcare point of view to address long COVID. And I just want to pick out a few, in my last few minutes, a few points from this and reflections. Reporting really needs to be better. I've just given a screenshot of how reporting is done. Usually it's about cases, and then deaths, obviously massive numbers across the world. But then this figure of recovered is really measured loosely between countries, if measured at all, whether that means for some countries discharge from hospital, or whether testing negative after testing positive for the virus. And many, many other countries, this is assumed and not measured in any rigorous way. And we need to measure the subacute and chronic effect of COVID-19, not just the acute effects. And we do this by defining things and having definitions for what we mean by non-recovery or long COVID, or the effect of prolonged effect of COVID. I want to touch on something really important, which is about avoiding stereotypes. Long COVID has kind of replicated, unfortunately, some patterns we've seen in other conditions about stereotypes. The predominant narrative, at least in Europe, is
I beg your pardon, Nisreen. In order to give some time for discussion, can you please arrive to the conclusions?
Sure. So give me 1 minute. Thank you. So avoiding stereotypes is not just something that affects middle-aged women. It affects highly functioning athletes, as I've seen in the picture. You've seen in the picture. So we need to avoid stereotype and give proper clinical assessment and solid diagnosis. Beware of generating stigma. Things suffered with HIV, other conditions like chronic fatigue syndrome, myalgic encephalitis, because there's a lot of stigma being generated for people with long COVID, and that pushes them away from healthcare, and the problem is complicated. We just need to show humility in the face of uncertainty, because there's just so much we don't know about this virus. And that needs to be acknowledged in all communication. And the last point really that I want to make is that we wouldn't be here talking about long COVID or, counting long COVID without activism from patients. So people with lived experience need to have a central role in shaping the agenda. And basically, I'm giving you an example. So there are lots of patient groups in Europe who, for example, came very recently together to create Long COVID Europe. And I like this quote from the website saying, "We offer unique expertise as a patient network, helping third parties including healthcare, including employers, to cover their patient-centric blind spots. Patient experience is key. I've got some points about silver lining, but basically just to say, closing up, but post-viral conditions is not a new thing. It's received very, very little attention, research in the past, and this is a silver lining of long COVID. We need to pay more attention to this for this pandemic and for future pandemic. It's not just about the acute effects of the pandemic. Thank you.
Thank you.